Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Hi guys, it's Dr. Jason and I'm here with Dr. Gav. We are the Dick Doctors who perform Caliber. Remember, confidence changes everything. How are you, Dr. Gav?
I'm really well, thanks, Dr. Jace. Thanks for having me here today. Great to be speaking again, as always.
Yep. So I understand you wanted to be explaining to people the difference between a HA filler, a gel filler, and a collagen stimulating filler.
Yeah, that's right. It's a really common question we get almost in every consult, really, because there are different options out there, not only in Australia, but all around the world. So I think it's a really good one. And, you know, the common questions are what's the difference in the results, the outcomes, what's the difference in risk profile? Are there any benefits of one versus the other? Those kind of questions. So yeah, that's I think a really great place to start today.
I guess, like I was explaining to you nearly 5 years ago, what I started off with in developing the Caliber procedure was using the HA gel fillers, the same fillers that you and I have been injecting into faces, lips, cheeks, that, you know, mostly women, I guess, for really the last 20 years. Mm-hmm. People sometimes have heard of like injecting collagen fillers. And, you know, we had those 20 years ago, but those didn't last very long. And so that sort of fell out. And then the HA gel filler came in. And because we had, well, at that stage, sort of 15 years experience with it and a good safety profile, that's why I wanted to use that to start with. And then, of course, the big thing is that it's dissolvable. There's a medication, Hyalase, and you can dissolve it away. And so that was really obviously where we started, and that's what I trained you with all those years ago.
Yeah, definitely. And you know, it's still the most commonly used product, both for the face and, you know, for our procedure, Caliber. And there's a reason behind that, as you just mentioned. It's the safety profile. It's fantastic. It's fully reversible. Guys feel much more comfortable knowing that, even though we're not reversing procedures really, but just
nobody wants it reversed. That's for sure.
No, exactly. But it's the peace of mind if you're doing something like this kind of procedure. You know, it's that area that you could potentially, if you want to, you know, reverse it. And I think that's a nice thing to know when you're doing this kind of procedure.
And I think when we did one of our earliest videos, we also talked about that tunability of it, where if you get a slight fullness in a certain spot, you can use the tiniest amount of this Hyalase medication just to smooth that down without making any, you know, difference to the overall size, and just to get that evenness and symmetry. And you know, everybody wants it to be, you know, nice and symmetrical, but full and fat.
And that's something not everyone understands. They think it's either it's in there, or when you reverse it, it's fully gone. And I think it's important to distinguish is that we can actually make fine adjustments using that enzyme, you know, Hyalase, to just really fine tune the symmetry. And I've had a couple of patients in the past actually get to know how Hyalase works really well. And there's some guys who don't mind a little bit of asymmetry here and there. They don't see it makes much of a difference. And when it's erect, it looks the same anyway. But there are some guys who really care a lot about the perfect symmetry, and I've had a couple of guys like that who have taken advantage of the fact that hyaluronic acid can be, you know, in small amounts dissolved, and have really fine-tuned that symmetry and gotten the perfect symmetry.
So it's absolutely right that if the appearance of it, if they're so pedantic about the tiniest little thing, the HA fillers are the way to go, because you've got that ease of adjustability over using a collagen stimulatory filler. So not injecting collagen, which was what we did in the lips, was harvested out of cows 20 years ago. So it's this microscopic particle of what's called polycaprolactone. I'm not sure if that's really very helpful. But
PCL, let's call it PCL.
PCL, yeah. And it goes in a gel carrier to get it into the tissue. And that PCL breaks down over time, and there are different versions of it, but they last for years and years. But it's not the PCL that is really giving the augmentation. It's the body's response to that and their production of collagen, and then that lasts a long time.
Yeah, and maybe a little bit longer than what we expect in different areas of the body. Because we know in Australia that the product we're using, the collagen stimulating dermal filler, is meant to only last 2 to 3 to 4 years, depending on the type that we use. But actually, in reality, in the penis, it may be lasting a lot longer.
Yeah. Well, it's an interesting thing because the kind of collagen that is stimulated has this half-life, meaning that half of it will break down over a period of what is apparently 15 years. So what we make, half of it will still be there in 15 years. And you go another 15 years and then half of it will be gone, so they're down to a quarter, so which is a long time. And until last week, I always said, I've never seen a patient who has lost their penis augmentation from this collagen stimulatory filler. I had a guy call up last week, and he had the 2-year product, and it's been 2 years, and he thinks that he's seeing a decrease in size. So we haven't actually seen him yet. That's the first time I've ever had a patient sort of come back and say, I need more volume. So that's, I don't know if you've ever seen anybody who's
not. I've seen patients come along for a small top up because they want extra size.
They're always wanting extra size, yeah.
But not because of decreased volume. Not with the collagen stimulating dermal filler. No, so I haven't actually seen that yet. But it's probably been about 3 years we're talking about since we first started sort of using that collagen stimulating dermal filler. So. But I guess, so most guys will be listening to this, and that's what they say to me is, well, if it's lasting that long, why aren't we going for that option every time? Why aren't we using that?
And so, as I was sort of saying, if you've got somebody who is extra intense about how their penis looks, and that there's not the slightest irregularity, a little bump or anything anywhere, then those guys are better off with the gel fillers. If that is going to drive them crazy, they're having this tiny little nodule, best to keep away from the stimulatory fillers, because it is relying on your body to make the collagen and create that volume. And although there are things that we can inject steroids, and we can modify the collagen that's being produced, not to that same sort of extent. So, if longevity is the guy's main aim, then the stimulatory filler is good. It's more expensive, as you know. It's a lot more expensive to buy from the suppliers than the gel fillers, and they're expensive enough. But maybe on a cost per longevity sort of scale, the stimulatory fillers have that slight edge. But it's sort of hard to know because, I did the first one about 4 years ago, and there's a guy actually on fallow boards, the forum, and we'll talk about fallow boards as a something as a resource for guys to go to, and maybe some of the guys are coming here because they heard about our show on fallow boards. But there's a member.
Excuse the pun.
On podcast, they won't be able to see the quotation marks. A member who did it almost 4 years ago, and every so often people are like sending him messages and saying, "Look, how's it going? Has it changed?" And it's like getting close to 4 years now, and he says, it's not changed. You know, it's exactly the same as what it was 4 years ago. So yeah, that's one of the best feedbacks that I've had, because as you know, you do the treatment, guy's happy, disappears, and you know, as long as he's happy, you never see him again.
Yeah, exactly. So then the downsides, I guess, for the collagen stimulating product would be in my eyes, is that it's not fully reversible with a simple injection. The tunability, we can't tune it and shape the penis in case there are any irregularities. The only option is really either adding more or waiting a long period of time until it dissolves. And then, of course, you mentioned briefly, but the stimulation of collagen can be so great in some areas that it can cause hardening of the tissue and what we call a nodule. And I guess just for guys who are looking into this procedure, a nodule is like just it feels like a lump, a harder area, like a little lump. And sometimes that can feel unnatural, and guys worry about how that might feel to someone, their partner, or someone who they've newly met. They don't want someone to know that they've had a procedure done. So that needs to be something that they consider. There are other guys who have had areas of hardening with overstimulation of collagen, who say when it's erect, it doesn't matter at all, and it actually makes it even better.
And when it's erect, it's hard. I guess that's another slight difference between the gel fillers and the stimulatory filler, is that when you start getting into bigger volumes, and I still tell everybody that I see that the most common volume I inject is 15, but maybe it's that, like when in their first 2 sessions, we do 15, but maybe we go a little bit more than that. That when guys start getting more and more, so I did a guy today, and we'd done a Skype consult previously, and I hadn't actually seen how he was endowed. He just sort of said, I've got an average to small penis. Anyway, he dropped his pants and showed, and he had this great big long thick penis. I'm thinking, why do you want anything augmented with that? But he was obviously keen to go ahead. But when guys are really starting to inject a lot of volume, say 20, 25 mils, and they're using the gel filler, when it's flaccid, sometimes they'll feel that it's a little bit soft and gel-like. And when it's erect, the penis is still as hard as ever. The skin is really tight because it's now having to stretch around this much increased circumference, and it could be 5 centimeters sort of bigger, maybe 5 centimeters when it's flaccid, and 4 centimeters when it's erect. It's a lot. The skin is tight, but sometimes I can feel that little bit of squish to the shaft of the penis. With the HA filler, I personally have never had a patient who's concerned about it, but certainly I've seen it on the forums that guys get it into their head that HA fillers, gel fillers, are going to be soft and squishy.
Yeah.
But have you ever had a patient who's been concerned about real squishiness?
Honestly, probably one patient who's come back and mentioned that it was not the kind of feeling he liked, but that's one out of who knows how many now, over 1,000.
Well, another way, did he want to go back to the way he was?
No, not really.
Nobody wants to go smaller again, do they?
No. So he was willing to compromise, but so I mean, and look, guys have mentioned offhand that yes, it may be when it's erect to have that slight, maybe they can feel the filler a little bit, but it doesn't affect the sex, doesn't affect the performance of their penis. It
affects it in that they're much bigger and their partners sort of notice and appreciate it. And again, we mentioned it before. I never expected that to be a benefit. I thought it was a locker room procedure, and they come back and say, "Whoa, the wife likes that." So that was interesting.
It was a great feedback. Going back to the HA, sort of the gel type filler versus the collagen stimulating type of fillers, there are pros and cons. I guess, as you said, I still basically use the gel filler as my main procedure. I would say 90% of the time, because of the safety profile, the reversibility, just because it works and it does last a long time. And guys are not getting top ups for a year, 18 months, 2 years. They're coming for smaller top ups, and it lasts a good amount of time. So they're not needing something that lasts longer. And then that you do have some guys who really all they care about is longevity, and really want something to be, and not wanting to come back and see us really ever again.
So, well, Dr. Dan, who is the other Dick doctor here, and hopefully he'll be able to travel again to Melbourne. But we were discussing that. Hopefully you'll be able to go to Melbourne with all the lockdowns that we've not been able to get back into Western Australia. Dr. Dan loves Alonce, and so where I would probably do 75% HA and 25% Alonce, I think he does 75%. Oh, sorry, I don't even meant to say the brand name. The collagen stimulating filler.
We can edit that out, I'm sure.
Yeah. The rules we've got. So he does 75% of the collagen stimulating filler and probably only 25% with the HA gel fillers. He just really likes it. And when he explains it and the longevity benefits, he finds that the majority of his patients are happy and they go with that. So it's sort of interesting, and it may be that one day that we're all doing 75% of the stimulatory filler, but because it does last so long, we've been asked that little bit more conservative in how we adopt it and don't want to rush in, because really this is still an experimental procedure, and we need to be very cautious with how we're spreading it to the patients and making sure that we're giving them the safest sort of option all of the time.
Exactly. And just with them understanding those options, often they will choose the safer option anyway. So there are, now of course there are other stimulatory fillers around the world that we don't have here in Australia, like PMMA. A very popular one, I believe, in Mexico. Well, Dr. C at the clinic in Tijuana in Mexico, probably the world authority, or definitely the world authority in using PMMA as a penile augmentation injection therapy. And he's probably done more penile augmentations, more penile injections than anybody in the world, I would say. He loves PMMA. So PMMA, polymethyl methacrylate, it's acrylic plexiglass, basically. There's a compound that's exactly the same as acrylic plexiglass, but it's made in a pharmaceutical laboratory. It's sterile. It's made to very, very precise and accurate dimensions and sterility. It's just not available here in Australia. We have had permanent stimulatory fillers here before, but the TGA, our drug regulatory body, is in the end sort of clamped down on them and banned them because the complications that they were getting were too high and too frequent and too significant. But it would appear that it's now they've solved a lot of those sort of problems. The Tijuana clinic has done a lot of it for many years, and they're clearly just not getting the big problems. And certainly on fallow boards where they talk about it a lot, there's a lot of patients who've been there, had it done. If they were getting significant problems from it, I think we would have heard about it. Now, there are other places in the world that you can get PMMA injected in, and that could be Korea, and Poland, and various other places, and with other doctors who clearly just don't have the experience and the skill that Dr. C has. And yeah, I've seen some very worrying results from that. And the problem is that
they're permanent. And have you seen any PMMA patients yourself?
I have, yeah, I have seen a few, and some really good results actually. Symmetry is great. The feeling of it's great. A little bit harder in certain areas, similar to our collagen stimulating option here in Australia.
Yeah.
But the guys have been really happy.
Were they done in Mexico?
Yes, they were. Yeah. I think I may have been seeing them here. They were coming for the glands, just some glands augmentation with some of the HA gel filler. But the result, I was quite impressed with the results. It certainly works. What I believe is there's different concentrations available of PMMA, and you know, depending on the concentration you have, it depends how much augmentation you get and how long it lasts and all that kind of stuff. But and I think
comes in a 10,
20,
and a 30%.
Yes.
So that means 10% of the volume that they're injecting in is these microspheres of the PMMA. And that has less stimulatory effect than the 20%, and then that's got less than the 30%. There's perhaps a slight trade-off in safety, that you're getting such a strong stimulation with a 30% that you've got a slightly increased risk of getting some nodules or harder sort of areas. So it's easier to use the lower percentages.
Yep.
And so 20% seems to be a really common sort of percentage to use, although every guy wants the 30% and get the maximum augmentation of the penis that they can get in the shortest amount of time with the least amount of volume.
Yes.
Yeah. I've seen one guy who had it done in Korea. Unfortunately, his penis looked a bit like a condom filled with peanuts or something. You know, it was lumps and bumps and stuff all over.
No, that's not ideal.
That wasn't so great. And we tried various things. I tried injecting steroid into the nodules, but then you've got to remember that inside that nodule, as well as being the scar tissue, is all these little balls of plastic. And so, we've got some improvement. And then in the end, I did inject some filler around it and between the nodules to cover it. But it's a worry when there's a permanent filler in there. If you don't have that perfect result, then you've got a permanent imperfect result. And if it's a little bit imperfect, maybe that's not a problem. But if it's a lot imperfect, if it looks terrible, then you're talking serious surgery to get that out.
That's right. And I think that's the important thing to understand, is that at the end of the day, if there's something permanent in there that's not dissolving anytime soon, it is a surgical procedure to remove that. And you're talking about cutting the penis open. Yeah.
And so there are then some other permanent things that have been injected into the penis. Silicon is one. And just for everybody, don't let anybody inject silicon into your penis. It's not a good idea. People have gotten away with it over short periods of time. It was used in the face back in the 50s and 60s. And sure, there are some people who are really good at it, and what they call micro droplet technique, putting tiny, tiny sort of drops spread out. But the problem is when it goes wrong, and it could be a decade later, 20 years later, it's just a nightmare. I've never had to cut silicone out of a penis, but I've cut it out of the face a number of times. And it's woven into the tissues. You've got scar tissue around it. The skin over the top is abnormal. You have to excise the skin as well. Silicone and the penis, just a no-go.
Yeah, it's really good advice.
Yeah.
But obviously there's also been in Australia as well, the fat grafting around the penis as well. Yeah.
So I haven't seen as much of that. It certainly sounds a little bit more plausible, and it can actually be done as what we call a pedicled graft now. So they used to take the strip of skin and fat from the crease underneath your butt, so what they call a infragluteal crease, and you can take a slice of skin out there. You end up with a scar underneath your butt crease, your buttocks, not in the middle, on the sides, and just where your butt cheeks hang, it sort of hides it. You don't really see it, and that's why they chose that sort of spot. But then it's a free graft, so you're taking it's totally detached from your body. They shave it down relatively thin and stitch it. So you've got to peel the whole skin of the penis off. So they make an incision around the glands. They peel the skin right down to the base, put these strips of dermal fat on, stitch it onto the penis, and then pull the skin up and close it around. Sometimes worked quite well, but they can get fibrosis and scarring and tightening, and they could get loss of length doing that. And then some guys would get a bit firm and fibrotic in there. So I think that the current technique is more using the skin and the fat from the abdomen, swinging it down and having it as a pedicle, so it's still got its blood supply. So you've got less chance of the fat sort of dying and having hopefully less of the scarring sort of issues.
But it sounds like obviously a lot more invasive procedure with a lot more downtime.
Oh yeah, I said that was one of the main things when we were developing Caliber. I want something that's walk in, walk out, painless. Nobody needs to know about it. You're back up in action in a short time, in a week, as in like back to having sex. Yeah, those were the sort of the things that when we were developing the procedure were really important, because sure, there was options of surgery with big downtime, big risk, big scars. And maybe we'll talk about that in our next video about what the options are for length and surgery and those sorts of things. But yeah, the whole idea was cosmetic medicine had moved into that minimally invasive sort of realm, and we were doing so much with injectable fillers, mainly for women, and we wanted to see if we could develop that for men, and that's where the Caliber procedure came from.
Beautiful. I like it's a big round circle. We've come back to Caliber and our procedure. So I think it's a great place to maybe end this episode.
Great talking to you, Dr. Gav.
Yeah, as always, we could talk for hours about these topics, but we probably have to stop. But thanks for joining us, and thanks for having me, Dr. Jace. Don't forget, guys, confidence changes everything. And it's been the Dick Doctors here. I'm Dr. Gav, and I had Dr. Jason Oates with me today. And it was great chatting to everyone, and we hope to speak to you soon.
Great. Bye, everybody.